Hi, everybody. Welcome to the May episode of Family Council Empowerment Hour. Thanks for spending your noon with us on Thursday. This is with my esteemed, wonderful colleague, Gloria Murray, and I. Gloria Murray is an ombudsman for many years in Upper New York, and I work as a family council. We both work as family council liaisons. We're meeting people from all over New York and from across the country to help them form, build, and maintain family councils, which is a wonderful entity to advocate for residents living in long-term care residences. And today we have our esteemed colleague. We're very excited, Lindsay Heckler from Elder Justice. She is amazing. She's learned. She knows everything. And if she doesn't know, she knows where to find out. So thanks for joining us for that. My other esteemed colleague, Haley Cronquist, is behind the light board, the keyboard, the everything. She's making everything happen and facilitating it. So thanks for joining us. And please don't be afraid to ask any questions about healthcare proxies and power of attorneys, especially for New York State. I know some of you are from a different state. While our New York law probably doesn't adhere to your state, it might be similar, but do get to know the laws in your state. We're being live cast, I guess, on Facebook at the same time. So we're happy to see you, and we're happy to have you join here with us today on this rainy summer Thursday in New York. Welcome, Lindsay, and welcome, Gloria.
Thanks, Janine. Welcome, everybody. Welcome, Lindsay.
All right, so I'm just going to get started and share my screen, if that's all right. Bear with me.
And for those of you who don't know what Long-Term Care Community Coalition is, we are a nonprofit advocacy group for people living in long-term care residences.
Okay, so I apologize. I have two screens and my camera's on this screen, but my PowerPoint's on the other screen. So I apologize for not looking at you directly. I'll do my best to keep going back and forth. So before we get started, I have to do the traditional lawyer disclaimer. So the following content is for informational purposes only. It is not to be interpreted as legal advice, and the information contained is not necessarily applicable to your specific case or circumstance. Also, I am only speaking about New York State powers of attorneys and healthcare proxies. If you are in a different state, please make sure to consult legal services in your state to talk about your specific documents there. So a little bit about me while you go through the agenda. So I am the Director of Policy with the Center for Elder Law and Justice, and then I am also the supervising attorney for our agency's long-term care resident advocacy program. So I do direct work with persons living in nursing homes, adult care, assisted living facilities, and we are also partnered with the Buffalo Area Long-Term Care Ombudsman Program, where we provide consulting support to the ombudsman for their advocacy. Where we're going today, before we dive into person-centered care and how family members as resident representatives can really support and bolster your loved ones' participation in their care and lives, I want to go to the foundation of some basic third-party decision-making tools. Again, these tools are specific to New York State. So I'm going to start with the power of attorney, move on to the healthcare proxy, then the Family Healthcare Decisions Act, and then we're going to go into the requirements and foundation for person-centered care and your role as family members or resident representatives. So the power of attorney, this is a legal document in which an individual who is known as the principal or the resident in our case gives authority to a third party who is known as the agent to perform certain tasks and conduct businesses on the principal's behalf. This document will list the various tasks which the agent is authorized to undertake for the principal or the resident. To be clear, in New York State, the power of attorney is a document for financial and property decisions only. To make medical decisions on behalf of someone, the individual must complete a healthcare proxy, and we'll talk about that. Agent or agents under a power of attorney document only have the powers granted to them by the actual document itself. They cannot go outside of it. In addition, and this is very important, agents are not entitled to determine who can live with the principal, who can visit the principal, and other decisions. So in our office, what we see sometimes is when there's conflicts among family members, the agent under a power of attorney tries to get the nursing home to visit or limit visitation from other family members. That in and of itself is not appropriate. Now, if there are potential safety concerns, there are steps that can be taken, but the power of attorney document itself does not give someone legal authority to restrict visitation. In New York, there are 3 types of powers of attorney: durable, which we'll briefly discuss, springing, and non-durable. We at our office, when we are executing power of attorney documents for clients, we only use durable powers of attorneys because the other 2, springing and non-durable, tend to be problematic for our clients for when they become in effect. So for today's discussion, I am focusing on the New York State durable power of attorney. So one principal, one resident in our case, can designate 1 or more agents. They can appoint up to 2 agents and up to 2 successor agents. They can work together or independent. It is up to the principal on what they can do and how they can act. Along those lines, and this is for everybody, not just us as family members supporting our residents, but this is very important information. It is very important that you consult an attorney if you are going to execute a power of attorney document, because it needs to be tailored to you and your unique circumstances. So in New York, while anyone could go to the New York State Bar Association webpage, print out the power of attorney and have it executed, it's not necessarily a good idea. And when we see that happen, sometimes it's invalid because certain things are not marked off properly. And then we also see sometimes the unfortunate event where the principal there's a bit of an echo, sorry. But we also see where there's cases of financial exploitation. So side topic, please, if you're going to execute power of attorney for yourself, please consult a licensed attorney in your state. This document only terminates at the death of the principal of the resident, if the resident revokes the power of attorney, or if the document is terminated by the court. I'm not going to go through this, and all attendees will have a copy of this PowerPoint, but these are the list of authorities in New York State that the principal, the resident, can grant to their agent. Before we move on to healthcare proxies, I want to go over a couple of common misconceptions that we hear out of Western New York and also on our statewide legal advice helpline. So there is a misconception that a power of attorney agent can make medical decisions on behalf of the principal. This is not true. Now, in other states, they do have documents called for healthcare proxies that are called, use similar language as a power of attorney, but not in New York. So in New York, it is only the execution of a healthcare proxy in order for a third party to make medical decisions on behalf of a principal, not a power of attorney. In many cases, typically the agent is the same for power of attorney and healthcare proxy, but they are 2 different documents with 2 different authorities. Now, if, and we'll talk about this, if a healthcare proxy does not exist, then in New York State, we turn to the Family Healthcare Decisions Act to determine who is the appropriate healthcare decision maker. So if I, as I have power of attorney, I'm an agent for my mom, but I do not have a healthcare proxy, my mom lacks capacity, I can only make healthcare decisions for her if I'm the appropriate surrogate under that act, and we'll talk about it. Me being agent under power of attorney alone is not sufficient for me to make my mother's healthcare decision. Another misconception that we hear about is that a power of attorney document gives the agent complete control. This is not true. And this typically comes up in our office when a resident is calling me and they're saying, I want to revoke my power of attorney. My adult daughter has locked me in this nursing home. I want to leave. To be clear, I mean, it's not as simple as what I'm about to say, but the power of attorney document in and of itself does not give the agent utmost control on where the person lives. The resident, the principal, does retain their ability to make their decisions and handle their own affairs. A principal can revoke the power of attorney at any time and for any reason, so long as they have capacity. When performing duties, agents must always act in accordance with the principal's instructions, and in the absence of such instructions, the agent must act in the principal's best interest. Now, if an agent violates their duties to the principal, the agent may also be liable for resulting damage. Where we see that in our office is out of our elder abuse unit, where the agent misappropriated the principal, our client's funds. So to debunk a common misconception again, the power of attorney document does not give the agent complete control. Now I'm going to move on to the healthcare proxy. And for those who are interested in New York State, it is in Article 29C of the Public Health Law. So this is when the resident, who is known as the principal, appoints someone who is known as the agent to make healthcare decisions on the resident's behalf should the resident lack capacity to make their own healthcare decision. So again, very clear, healthcare proxy, healthcare decisions on the resident's behalf when the resident lacks capacity to make their own healthcare decisions. So breaking this down a bit further, what is a healthcare decision? This is any decision to consent or refuse to consent to any treatment, service, or procedure to diagnose or treat the resident's physical or mental condition. So this is not, for example, signing an admissions agreement. That is not a healthcare decision, but that is a contract. The resident's behalf. The agent should make the same healthcare decisions as the resident would have. So when our office is working with residents to execute a healthcare proxy, we strongly advise our client to have a conversation with their prospective agent to make sure everyone is on the same page so that there is no confusion, such that when and if the resident lacks capacity, the agent has the tools they need to make the decisions as the resident would want them to be made. Capacity to make healthcare decisions. So this is the ability to understand and appreciate the nature and consequences of a healthcare decision. So this includes considering the benefits, the risks, and the alternatives to any proposed healthcare to reach that informed decision. And this is typically where we see when I'm working with clients or the ombudsman program where tensions tend to flare. So what is capacity? Well, it's fluid and very case specific, unfortunately, and also fortunately, depending on the circumstance. So to be clear, the healthcare proxy in New York only activates when the resident lacks the capacity to make healthcare decisions. It is only then that the nursing home or any provider should listen to the agent over the resident. Now, this is good for us not only when we're advocating with or on behalf of a loved one in a nursing home, but also for our own daily lives. Just because I execute a healthcare proxy where I have my son as my agent doesn't mean my agent right now, my son, could start making my decision. It's only when I lack the ability to make my healthcare decisions. He can act on my behalf. Does not matter where I am, nursing home or hospital, for example. So how is capacity determined? It is determined only when the attending physician determines that the resident lacks the capacity to make healthcare decisions to a reasonable degree of medical certainty. So the attending physician's decision must have four things. Has to be made in writing, so often in the chart, contain their opinion as to the cause and nature of the incapacity, contain their opinion as to the extent and duration of the incapacity, and be in the resident's medical record. And importantly, it is the nursing home's responsibility to give the resident the decision orally and in writing if the resident has any chance of understanding what it is. So this is a situation, and this is my opinion, where the law in New York is clear. However, implementation of the law is very gray and muddy because we know, and I know you all know this, how often does the nursing home physician meet with the resident? Are they actually meeting with the resident properly, or are they reviewing the notes of the nursing staff, the PA or the NP? Are they actually doing person-centered care and person-centered assessment? So if you are advocating with your loved one in a nursing home, and the nursing home, for example, is saying, well, your dad doesn't have capacity, but you don't think that's correct, that is a time where working with your loved one can really advocate for that individualized person-centered assessment. Next, I want to go into a couple of misconceptions about the healthcare proxy. The big one that we hear and see about in Western New York is that the agent can immediately make decisions on behalf of the principal. This is fully incorrect. Again, and I know I'm really emphasizing this point, the agent can only make healthcare decisions on the principal's behalf only if a physician has declared the principal lacks capacity. So, has the physician documented the cause of the principal's incapacity, the nature of the principal's incapacity, the extent of their incapacity, and the probable duration of their incapacity? So, for example, do they have a UTI where a severe infection where that directly impaired their cognition, or is there another issue going on? So it needs to be very specific, person-centered, or tailored to the individual. Another misconception. Once I create a healthcare proxy, I can never change my agent. That is not the case. So in New York law, a competent adult may revoke a healthcare proxy by notifying the agent or the provider, so the nursing home, the physician, for example, orally or in writing. It's very simple, for better or for worse. I'm not making a comment either way, to revoke a healthcare proxy. And the presumption is in New York state law that the principal has capacity. It's a presumption. One of the concerning things, and this is not just for when we're advocating with and on behalf of our loved ones in a nursing home, but our own lives outside of the nursing home to be aware of, is a healthcare proxy is revoked upon execution by the principal of a subsequent healthcare proxy. So I know, speaking for myself, whenever I go to a medical office, they're asking me, do you have a healthcare proxy? Do you want to sign a new healthcare proxy? Or if you're going to go into a hospital, they're asking, do you have a healthcare proxy? Do you want one? They're throwing all this paperwork at you. Be careful, because if you have one, if a provider asks you to complete a new one and you mistakenly do it, you could unintentionally revoke a prior healthcare proxy. So if, for example, my son's my agent, I go into the emergency, they don't have my healthcare proxy on file, and they say, oh, Lindsay, you got to have this healthcare proxy just in case. Oh, okay. Well, if my daughter's with me and I sign a new healthcare proxy naming her agent, I just revoked the one with my son. I do see something in the chat, so I'm going to pause if that's okay. Paley. Yes, please type in questions. I'm happy to answer them as I go. Another misconception that we see and hear about in Western New York is that the healthcare proxy, the agent, can always access the resident or the principal's information. That is not correct while the principal has capacity. That is because it is only when the principal lacks the capacity to make healthcare decisions that the proxy, the healthcare proxy, is activated and the agent can access the medical records. Now, the principal has the ability, with or without having a healthcare proxy, to allow access to records to a person or entity of their choosing. So many times, but not always, if a resident has a healthcare proxy and they have capacity, they will sign a HIPAA form authorizing the nursing home to release information to the agent under the healthcare proxy. So again, a HIPAA form is different from a healthcare proxy. The only time the agent under a healthcare proxy without a HIPAA authorization or other authorization by the resident can access the resident's information is when the resident has been properly declared to lack the ability to make their healthcare decisions. That's a bit of a nuance and can be a point of frustration for family members when they're trying to help advocate with and on behalf of their loved one. So again, the healthcare proxy document in and of itself is not the determining factor for whether another person has access to your, if you're the individual or the resident's records. Now, the last misconception that we hear about and have had clients come to us with concerns on. Misconception, the healthcare proxy agents can make decisions on all aspects of the principal's life. Fully incorrect. And I apologize, I'm really, focusing on these points for a reason. The agent can only make decisions that pertain to the principal's health care decisions. For example, the healthcare proxy does not pertain to financial matters such as medical bills. That in New York State is a power of attorney. So power of attorney in and of itself does not allow the agent to make healthcare decisions. The healthcare proxy, it allows the agent when the principal lacks capacity to make healthcare decisions, but they do not have the ability to handle the medical bills with that document. So what happens if the resident does not have a healthcare proxy and they lack capacity? That is when the New York State Family Healthcare Decisions Act becomes in effect. So this law allows others who are known as a surrogate to make healthcare decisions for the resident when the resident is not able to and has not designated or appointed a decision-making surrogate. In New York State, there is a hierarchy list. It starts with an Article 81 guardian, if one has been appointed by the court. If there is no court-appointed guardian, it then goes to the spouse, if they are not legally separated, or a domestic partner. If there is no spouse or domestic partner, or they're not willing to act or unable to act as a surrogate, it then goes to the adult children, followed by a parent, followed by adult brother or sister, and then a close relative or friend who knows the resident or their religious moral beliefs. So there is a list, and it is on the family members and the friends to try to work together, and also the nursing home's responsibility to work to find out who is the proper decision maker in their specific residence situation. So that is the basics or the foundation to authorized representatives based in New York State law. Now I want to switch to some fundamentals for resident rights. The biggest one is person-centered care. I know there's a lot of information on this slide and it's busy. You will get these slides. I intentionally copied and pasted both the federal definition of person-centered care and the New York State definition of person-centered care because it's important. And us as family members or other advocates for persons living in a nursing home, we really need to remember the principles of person-centered care. So we are to focus on the resident as the locus of control and support the resident in making their own choices and having control over their own daily lives. So for example, when it comes to care planning, and I'm sorry if you've experienced this, but it's what I've experienced personally in my life and clients' lives, is the nursing home tries to only schedule, for example, a 15-minute care plan meeting. And they don't invite the resident. They only invite you as their representative. Well, that's not appropriate because are they really involving the resident? Are they taking the time to involve the resident? So you as their representative have the ability to really shift that dynamic to bring the focus back to your loved one. So for example, I'll use my mom. My mom's in a nursing home. Say she has a type of dementia, her capacity is waning. So she has good days, good moments, bad moments. Nursing home says, Lindsay, we've got your mom's care plan meeting scheduled for tomorrow, May 24th at 4 o'clock in the afternoon. Well, if I know my mother is better in the day, I have the ability to respond back to the individual, often the social worker, to say, well, I really would like my mom involved. These are her choices in her life, and afternoons aren't that good for her. Can we reschedule to a more appropriate time? Can you make sure that I have time to speak with my mom to prepare her and so she can participate in the meeting with me? So again, person-centered care. There are nursing homes and staff who do a really good job of trying to involve the resident, being intentional and taking the time. But even in those nursing homes, it's challenging with limited staff. So us as family members and advocates can really push and advocate to shift the narrative back to the resident, our loved one. Next, and this is from the federal regulation, the resident has the right to designate their representative. So any person resident who has not been determined to lack capacity by a court has the right to designate a representative to exercise their rights on their own behalf. So if my mom doesn't have a court-appointed guardian, the presumption is she has the ability to designate me to be updated on her care, to be updated on when her care plan is, for example. My mom, as the resident, also has the right to choose the extent that their representative may exercise those rights and has the right to revoke the designation of the representative. So for example, and this is where some family dynamics come in and it's challenging, and I'm a big fan of mediation and quite frankly, group support and conversations because of this. My mom, I could be her designated representative in the nursing home. So we're not going to talk about power of attorney or healthcare proxy. I am my mother's representative. I'm her emergency contact. My mom tells the nursing home, yes, please update my daughter, Lindsay, on my care. Okay. Well, next month, she could be mad at me because she's still in the nursing home and frustrated about that. My brother comes in and says, no, Mom, we're going to get you out of here, right? And my mom's like, that's right. And she has every right to tell the nursing home, cut off contact with me. That leads down to a whole series of scenarios, which are case specific. But my mom, if she has capacity, she has the right to do that. It's also on the nursing home, however, to ensure that the resident's representative does not make decisions outside those delegated to them by the representative. So the simple example I have is the healthcare proxy. Just because I'm my mom's agent under the healthcare proxy doesn't mean I have the automatic right to access her records because she has capacity. My mom has to designate that right to me typically by filling out the HIPAA form. In addition, the designation of a resident representative does not absolve the nursing home's obligation to be resident focused. So in the situation involving my mom, where my brother and I are feuding siblings, and say in this example, I have power of attorney, that doesn't mean the nursing home should be going right to me. They should be going to my mother, the resident, to counsel her, support her, walk her through what's going on, and really focus on what she wants. Now, it's easier said than done in many situations, but again, it's the nursing home's responsibility to be resident focused. I see a question in the chat, bear with me. Okay, Jeremy Spiegel asks, and I hope this is okay, does one practically designate a resident representative, or how does one, designate a resident representative? I would say that if I'm the resident and the nursing home is doing my individual assessment and care planning, it should be in the record. This way, all staff know. Can you have multiple resident representatives who work in tandem with each other? In theory, yes, but it can be confusing and it can lead to challenging dynamics, especially when nursing homes have to notify someone when something has happened, so their loved one has gone to the hospital. The last question is a healthcare proxy an automatic representative? Not necessarily. I think in practice, it's that is what happens. So, oh, Lindsay, you're your mom's healthcare proxy, so you're her representative for everything. I think that happens more than it should in practice, but technically it should be my mom if she has the ability to do that with informed consent.
Lindsay, can I follow up on that real quick? This is Jeremy.
Of course, of course.
Right, really quick. So I would agree that you obviously want to make sure that you're being organized as far as if you have multiple resident representatives. But is it fair to say that you have in general like a primary one as far as say with notifications, like in other words, like they have to notify somebody, but having a second person who can kind of like pitch in as needed as long as there is clearly like, coordination. And does it matter if the resident sort of says, yes, I want both my sons, like to be able to advocate for me as needed? Is that a fair expectation?
I think that's fair. And for practicality purposes, the nursing home's only really going to want that one point person, which is why it's important to have these conversations and make it, and again, family dynamics. So
Well, everyone on the family, in other words, would be like, that's fine. It's
correct,
just
yep.
literally the nursing facility that would be like, I just want it to be one person, but that's not always practically feasible in real life. So it's good to have a second person be able to kind of write the email, to make the phone call, to do whatever is needed, as long as you're doing it in like, coordination, that you're not overlapping, because that's usually the issue. And
Correct.
so is that a fair expectation that the facility should respect the resident and their family's sort of, desire to be able to work in the way that I just described?
Correct. I would say that's fair. And also from a compliance, so say I have my corporate compliance hat on from the nursing home's perspective, that makes sense. And it should be very clear in the resident's record. So, contact this person. If this person's not available, contact this person. It should be very clear. And it doesn't happen. We see this. So we have a guardianship unit in our office where we're court-appointed guardian as a last resort. So the court judge has determined this person lacks the legal ability to make their decisions, but there is no one able to serve. We're last resort. We have sent the court order there. We have mailed it, certified mail, physically dropped it off to certain nursing homes, and they still have issues putting it in the file so that we, as a court-appointed guardian, are contacted. So yes, it should be very clear, but whether the nursing home does it is a different issue.
And if they don't, what's the recourse?
Depends how active the state enforcement entity is. We will, as guardian, we are able to request the record to verify, and we have attorneys, social workers, and other staff who will physically go to the nursing home and inspect their file to make sure it's listed properly.
Okay, thank you.
So this next slide is right from CMS. Did I skip a slide? Oh, I apologize. So this is right from the federal regulation, and in the slide I have a citation to the New York State, the similar regulation. So federal and New York State rules are pretty clear. The resident has the right to designate any individual they choose to act on their behalf to support the resident in their decision making. So whether it's accessing medical, social, or other personal information of the resident, helping them manage financial matters or receive notifications. If the resident has a power of attorney, their court-appointed guardian, their social security representative payee, then the nursing home has to follow their directions so long as it's within their authority. So power of attorney, for example, has the ability to execute contracts, pay the bills, doesn't have the authority outright to make healthcare decisions. Now, this slide has snippets that I have taken from CMS guidance to state survey agencies. So New York State, the Department of Health, on what the Department of Health should be looking for, what they should be considering when they're investigating concerns involving the rights of exercise by representatives and the person-centered care. Side tangent really quickly, if you bear with me, every nursing home operator, administrator, management, so director of nursing, social work, whomever, should know about CMS State Operations Manual Appendix PP. It's CMS's interpretation of the federal regulations. It's their guidebook. So it is concerning to me when I meet with an administrator and they have never heard that term before or say they have. That's a different tangent for another day. Just wanted to make that point. But CMS, this is their expectations. A competent resident may wish to delegate decision-making to specific persons, or a resident and the family may have agreed among themselves on a decision-making process. So talking amongst themselves, coming up with a plan, a coordination. Also important, whether a resident has or has not been judged incompetent by a court of law, so court-appointed guardian situation, if it is determined that the resident understands the risks, benefits, and alternatives to the proposed healthcare and expresses a preference, then the resident's wishes should be considered to the degree practicable, including having the resident input into the care planning process. So using our office's guardianship team, for example, even if we are appointed guardian of the person and the property, so we have the ability to we step into our client's shoes, we still, as practice, involve the client as much as they can to participate in their lives. We don't just go, well, we're guardian, what we says go. We have a responsibility to do our best to involve the resident. And I see a couple of items in the chat. Oh, yes, I'll type that in, Jeremy. So in summary, regardless of your designation as a representative or authority, so whether you're power of attorney or, agent under power of attorney, healthcare proxy, surrogate, guardian, or other, we need to involve and include the resident to the extent practicable. We need to support the resident in their decision making and really put them on the pedestal and bring the focus to them. And sometimes our opinion as to what's best for the resident might not be what they want. So power of attorney, healthcare proxy, surrogate, guardian, these are things to be aware of. And we can also, as supporters of our loved ones in nursing homes, we have a fundamental responsibility to remind the nursing home to involve the resident. Many of the staff in nursing homes want to implement person-centered care. However, reality is they're short-staffed and they're unfortunately trying to go from task to task to task. Working together as a team, we can really bring the focus back to the resident. So how would the resident decide if we don't, if they can't direct? Really the person-centered care principles. So this is my last slide. People are welcome to email me directly, and I'm happy to send resources. We have our resources on the slide. They're good, but you all are aware of the Long-Term Care Community Coalition's resources. They are excellent. They have excellent person-centered care tools at your disposal to use. Please go there. Please use them. We also, for folks who are in New York State, we have a free senior legal advice helpline for anyone age 55 and above. It is open Monday through Friday, 9 to 11. If you call outside of those hours, you can leave a message. And we also have an email, and an attorney will respond to you in about 3 business days. Caveat to that is if you're calling on behalf of someone else, the attorney can only give you general information. We have to speak to the actual individual who has the potential legal issue. Our office, we are civil legal services, serving 10 westernmost counties of New York State. So we have a healthcare advocacy unit, Medicare, Medicaid, private insurance issues, consumer, elder abuse prevention, and more. You are welcome to visit our website or call us for potential representation. Again, we are specific to Western New York. So with that, I'm going to stop the screen share so I can better see the chat and type in some information.
That was wonderful. Thank you so much, Lindsay. That is just a font of information. Thank you, Jeremy, for asking your questions, even though you're in Massachusetts. It is so, it's wonderful to hear your passion and your mission to care for your mom and the residents at her home.
Thanks. I have another one in there, actually, if you wanted, that could be applied universally.
Okay. Thank you, Julie O'Donnell. We have a few questions from people the registrants who, when they registered, they added these questions to the registry. And I wanted to just thank personally the ombudsman from California and from Arizona who are joining us. Thank you so much. We look forward to working with you on the family councils in your state. It's good to see that family councils are just getting to be a bigger and better, widely seen entity for advocacy throughout the country. So thank you for that. There is a question. When does a healthcare proxy take over?
It is only when the physician has gone through the proper process to determine that someone lacks the ability.
And is it okay if that healthcare proxy isn't the spouse of the resident?
Yes, but it can make things a bit challenging with respect to like family dynamics. But so say we'll use my parents, right? My mom's in the nursing home, my dad's not. I'm my mom's healthcare proxy. For sake of discussion, she really does not have capacity to make her healthcare decisions. The nursing home should be going to me and not my father because she designated me. Now, if she didn't have a healthcare proxy under the New York Family Healthcare Decisions Act, my dad would be the decision maker.
Thank you for that. There is a question from a registrant who isn't on right now, but she asked, what is the procedure to change the proxy from a friend to a family member?
All you have to do is execute a new document. And what I can do, Janine, I'm gonna update my slides. I'll include more links and resources on healthcare proxies. So this way, if people are interested, they can go to the Department of Health website and other resources like the Conversation Project to do that. But it is very easy to change a healthcare proxy,
Thank you
which
for
has
that.
pros and
Okay, thank you for that. Are there any questions from our audience who are with us now?
if I see another one from Jeremy, if I can read that out loud or.
Yeah,
So Jeremy asks, when resident representative raises issues, files a grievance, or asks questions, are they to be responded to in the same prompt and complete way as if the facility is interacting directly with the resident? In other words, if a resident representative has a complaint or files a grievance, shouldn't the resident rights apply to the healthcare proxy too, as far as responding to the grievance? As a resident advocate, I would say yes, because the resident has made that designation. In practicality, I have not had a call to my office on this issue. I don't know if anyone on this office on this call who's an ombudsman has encountered this, but my interpretation is yes, as the representative, and we'll say healthcare decision. I'm upset with my mom being left in her bed all day and not being provided basic hygiene care. I would say I have the right to submit a grievance and as part of that be provided a full response. But again, reality, I don't know. I haven't had a direct complaint by anyone on that. I don't know how that has played out.
you use the term grievance, and that is, it sounds like such a weighty thing to do, but it is an effective way to get a nursing home or long-term care residents to act on a complaint or something that you've shared and that you haven't seen any kind of response or a solution to.
Mhm.
Is that
And
right?
Yep, fully correct. And it's not a bad. Now, this is a general discussion. So from a nursing home's perspective, they shouldn't review or view someone filing a grievance as something automatically bad. Someone has a concern. There is a valid reason for a concern. Well, let's investigate it. How can we move forward? How can we make things better? How can we work collaboratively? And I see Richard laughing. It was pre-pandemic. CMS tried to, I don't know, I can't remember if they did, but roll back some of the grievance requirements, including that they have to maintain the grievance files for I'm blanking on the years, a few years. Well, if I'm a nursing home operator, I want to track those grievances. So are residents on one unit complaining about similar things? Are there complaints about one staff member popping up all around? I want to know about that. Is the food terrible? What can I do to remedy that? Use the information in a positive manner.
Lindsay, your response shows that you are resident-centered through and through.
Mhm.
Thank you for that, because that hasn't been the experience for many people I know, including me, when writing a grievance. So thank you for that. It is not a bad word. It's just an escalation of a complaint. And you're looking for a response or a solution, and that is it. It's not a lawsuit.
No,
Thank you
let's
for that.
avoid going to,
Yes,
right?
exactly. Jeremy, was your Lindsay satisfy your question? Has she answered it?
Yeah, and unfortunately, it's true as far as the in reality thing is unfortunately very relevant, what should happen versus what does happen. But that's accurate to say. So it's good to know, like, at least what the expectation is in that. So thank you.
Mhm.
Anyone present here, do you have any questions or any musings, anything about healthcare proxies and power of attorneys?
Lindsay, I have a question. It's Gloria. Is it just one physician that determines that a resident or a person is incapacitated, or does it need two physicians, or how do they do that? Is there a test that is done on the resident and then referred to the doctor to say they're incapacitated?
It's one physician. Now, when you get into certain end of life and life support scenarios, that changes typically in the hospital. But for our purposes, it's one physician. Now, it's up to the physician how they go through to do it. What we see, unfortunately, is the physician reviews what others in the nursing home have said about the resident instead of doing that individualized, person-centered, really assessment. The physicians aren't at, unfortunately, there are some very excellent medical directors and physicians, right? In some of the more underperforming nursing homes, I'll put it that way, I find it very questionable when a resident has the ability to make their decisions in week one, and then the following week they don't. The physician says they don't. So I can be a bit cynical, but the law in New York is it's the physician, and there should be an assessment of the actual resident, not just based solely on the NP's notes, nursing notes, social work, etc.
Okay, great, thank you. I think Teresa has a question.
Yes, can you hear me?
Mm-hmm.
Yes.
Okay, I'm in Colorado, and here you didn't bring up anything about mole swarms. I believe mole swarms are in New York, right?
They are.
But here in Colorado, it's the most form. So how does that work? Are they, across the states? Are they the same? Are they recognized, the moles forms, moles and most, let's say there's a resident here in Colorado, but their daughter is on the most form here, and she's back in New York. Is that all recognized throughout the states, these forms?
I don't know. I've never encountered that. For New York, it's really it's an order specific by a physician. I can look into that. I don't know though.
Okay. I was just wondering about the mole swarms
Mhm.
because on those are, DNR, CPR, feeding tubes, things like that. And you can even appoint somebody who can talk healthcare proxy, let's call it, on those forms. So yeah, so I'm just wondering, are they recognized between all the states?
I'll look into it. I'm pretty
Okay.
sure it's going to be state specific. So it's most in New York. What's it called in Colorado?
Most, MOST.
Okay.
Thank you.
Yeah, I'll look into that.
Thank you for that, Teresa.
In West Virginia, it is the post form. Thank you, Ed. I'm writing this down. I'm not ignoring anyone.
That's good to know. It's good to know. Does anyone else have a question on either healthcare proxies or power of attorneys, especially in New York? We've got a few lawyers on with us, which is really, it's fun to see. You've got an audience, people who want to learn more and be better advocates for their loved ones and for the loved ones' neighbors as well.
I just want to say thanks, Lindsay, for bringing the person-centered approach back to the topic, because so many families forget to include that resident, and it's important.
Well, thank you for having me. And it's not necessarily, and I hate to say, and I hate calling it a system, but the system's set up to forget the resident because it's easier to go right to a family member than work with the resident in many situations. So it's on us as family members. My grandmother, she She's long since passed, but when she was in the nursing home, my father and we were there advocating for her, including her. So it's really on us to speak up and bring it back to our loved ones.
Yes, definitely. Thank you.
Thank you.
For those of you who are looking for either support or advice on forming a family council, Gloria and I can work with you. I'm happy to email you in the next few days, just to introduce ourselves and a form if you would like to Zoom with us, just so we can get to know you a little bit better and to find out if you have any issues concerning your loved one living in a long-term care residence. We would love to work with you. It doesn't matter where you are. We've worked with people throughout the country and it's very exciting. Thank you, Lindsay. I learned a lot. I'm my dad's healthcare proxy, but I'm his alternate power of attorney. So it was good to hear what my choices are and what my next steps are. Thank you for that.
Thank you.
Any questions? Anyone, any comments or questions at all? Please feel free to jump out and ask. No? Okay. I think it is a good time to wrap up. Gloria and I and everyone at the LTCCC want to remind you, well, have a safe Memorial Day weekend, of course. In June, we've got two exciting webinars for you. We've got our own Family Council Empowerment webinar, which will be on Thursday, the 27th. And then I believe the LTCCC much anticipated monthly webinar is on Tuesday, the 20th, I think it is. I'm not exactly sure, but
June 8th.
there's a registration. Sorry, the 28th?
Yeah, sorry, June 18th.
June 18th. Okay, sorry about that. I was off. But please feel free to register. Even if you can't make it, you will receive the program emailed to you afterwards. And you can share it, watch it at your leisure. Thanks for joining us. And we look forward to helping you and working with you on advocacy. We make a difference. You make a difference. So thanks for your advocacy.
Thanks,
Thanks, everyone.
everybody.
Bye-bye now.
Bye-bye.
Yes.